So, and that's important because in terms of the management that we're talking about, the follow-up management, if you give a remedy and they're taking it every 20 minutes or 30 minutes or every hour for several hours and there's no change, well, you have to make a decision, when are you going to start trying a different remedy? And so that might be after 3 hours or 6 hours or 12 hours, but certainly for an acute case, if you've been giving it the same remedy, over and over again, every hour or 2 or 3 for 12 to 24 hours, if there's no change after 24 hours or 12 hours, you want to consider another remedy, because you should expect that you get something that to happen that quickly. And like I said, most often, general rule of thumb, you should see something significant starting to happen within 3 to 6 hours. If not, it's probably not the right remedy and you need to try something else. Okay. The other issue is you should be aware of is suppression. So when you're treating with homeopathy, ideally you want to try to avoid suppressing new symptoms that come up. So if someone's already on a regimen of medications, certainly as a lay person practicing homeopathy, you don't want to be talking to them about removing or stopping those medications. That would be something more for a professional homeopath doctor to look at. But, and even with myself in my own private practice, I don't typically take patients off of medications or recommend that they do in the beginnings of care. After they're starting to show good signs of improvement, then we have them work with their prescribing doctor to wean themselves off these medications that they need for chronic conditions. But you don't want to take someone, the last thing you want to do is take someone off of the medication that's keeping them stable and you have this huge spike in their symptoms before the homeopathy has had a chance to work. However, if you're treating someone with homeopathy and they have a new condition come up, you want to ideally try to treat that new condition, if possible and appropriate, with homeopathy. And if you don't, and they take a new drug that they're not used to taking on a daily basis, a new drug that's going to suppress that symptom, that can make the underlying condition that you're already treating them for get worse. So the idea is, if you suppress a symptom, the symptom is your body's expression of the fact that it's trying to deal with a disease, and the symptom is an expression of that. And if you suppress that, the body will find another way to express that disease, or express the body's ability, the body's attempt to try to heal that disease. So if you suppress one thing, another symptom may come up, and that second one that may come up may be more serious. So in the case of a skin rash, for example, you might suppress the skin rash from coming out, but now their asthma gets worse, which is a worst case scenario. So you want to try to avoid suppressing symptoms when they come up as you're treating someone, and try to find a remedy that addresses that new symptom. Does that make sense?
So it would be like you're already treating them for condition A, and then this other symptom B comes up. Would you try and find an additional remedy to resolve that problem, or just leave it alone until condition A is resolved?
Okay, so the question is, if you're treating someone already for condition A and now new symptom B comes up, do you switch remedies to try to treat that symptom, or do you wait, or what do you do? And the answer is it depends. So you want to look at, like, for example, in the case of if you're treating someone with let's say a bad cold, and in the course of that they start developing a skin rash, the problem that they've had in the past, that may be a good sign of healing, and you want to kind of leave that alone, and there's other ways to manage that than prescribing something. But if the skin rash got bad enough, you might want to find a remedy to address that. And you can give 2 different remedies to the same patient in the same general period of time, just not within the same hour. So, for example, a patient could have a cold where they have a bad cough and a bad sore throat. Usually one remedy will address both, so we would consider that one disease, or one similar disease with several symptoms. Okay. But there's also a case where you have a patient with a cold and you give one remedy helps with the cough, but it doesn't help the sore throat, but another remedy helps with the sore throat. So if you're able to find that, it's good enough, go with that and say keep taking the remedy for the cough, quote unquote, and when the cough gets worse, take this remedy, when the sore throat gets worse, take this remedy. Just try not to take them within the same hour.
Yeah.
What happens if they overlap just with the loop?
It's just can confuse the symptom picture. It can reduce the effectiveness of the first remedy, so that's why it's best to wait at least an hour between remedies to give the body a chance to react to just one thing at a time. It also makes it easier for follow-up. Well, they got better or worse. Was it this remedy or was it that remedy? So it makes it more clear. Is that clear so far?
Mm-hmm.
Okay. Other thing to be aware of is dentistry and other elective kinds of surgery. These conditions can these situations, having extensive dental work or surgeries can make a chronic condition worse or can have it relapse. So there are acute remedies you can use to help with that, whether or not the patient has a chronic disease or not. If someone's going in for extensive dental work or elective surgery, there are guidelines on remedies that you can use to help with that, with the pain, the inflammation, and speeding up the recovery from that. So in the essential information handout I have, and we'll talk more about first aid, but I have a whole protocol here for how to take, for example, the remedy arnica and hypericum pre and post-operatively so you improve the outcome. Very often by doing so, patients don't need to use pain medication following surgery, or they can reduce the amount that they would otherwise need substantially, significantly. And by taking less of the medication and by taking the remedy, you're doing two things. You're doing one thing, but it's going to affect, by those two things, you're going to increase the recovery, decrease the recovery time, speed up accelerate the healing. So, and at the same time, decreasing chances for post-operative complications, like infections and things like that. So that's a good thing to understand. There's another section in here on skin eruptions and the neutral bath. So in the case of rashes and skin problems and itchiness, you can do this thing called the neutral bath, where you're basically soaking in water that's roughly skin temperature, like 96 to 98 degrees. And just by doing that, you can relieve a lot of itching and redness and things like that without having to take a medication to do so. So the details of which are described in the handout there. There's also a section in here in the handout that talks about hydrotherapy for headaches. So if you were to have a headache, it talks about using a treatment called hydrotherapy, which we'll talk about as we go through first aid and the specific conditions that we're going to be treating. But hydrotherapy can be a great adjunct to homeopathy. This is something that's okay to do. It doesn't interfere with the remedy's ability to work. So again, you can read that information. And then the next section, it talks about travel medicine, vaccinations, and homeopathic prevention. This is best done through the advice and consultation of a professional homeopath, but there are lots of ways that we can prevent. We've talked about the flu, but also for travel medicine, for different kinds of conditions, homeopathy can offer an alternative to conventional vaccinations for these different diseases that we face. So that's something to keep in mind. Alright, so that is pretty much the essential information handout. I would encourage you to read through that, and if you want a copy of that, my website's on the bottom of the screen there, progressivechiropractic.com. Just go there, you can send me an email, and I can send you an attachment with that document, and all of the documents in this course for that matter.